Depression and anxiety rates are rising. Collaborative care is a team-based approach to improving mental health in primary care settings, but several barriers exist. At New York Presbyterian Hospital, we found that depressed patients are often underrecognized due to screening inaccuracies. We also found that even when referred, 20 to 40% of patients did not show up to mental health appointments due to stigma and treatment misconceptions. Research shows that primary care provider involvement in mental health treatment improves patient satisfaction, treatment adherence, and cost. However, providers often lack the time and support to do this. To solve this issue, a team of experts, providers, patients, and mental health workers created DepCare. DepCare is a personalized, culturally tailored, web-based application aimed at improving depression screening, education, and management in primary care settings. In this video, we will discuss our DepCare intervention and show you tools to help you manage your patients. DepCare supports clinics in implementing tele-mental health programs like tele-collaborative care. It screens patients for depression and anxiety prior to their visit with you. It activates patients to discuss their symptoms with you and to improve attendance to their mental health visits. It sends you a DepCare summary report of patient preferences and collaborative care referral indications via Epic. It provides you with medication management tips, triage, and referral support. And it bypasses the doctor so patients can directly refer themselves to collaborative care. Based on our research, we found DepCare to be highly effective in reducing perceived barriers related to cost, access, convenience, and stigma. It's user-friendly, available in English and Spanish, and effective in elderly and low literacy populations. DepCare improves patient decision-making, awareness of options, and use of antidepressants. DepCare has 3 steps. Your patient will receive the tool by email, text, or in the clinic before their medical appointment. They will then complete the personalized tool with help from the DepCare team. A DepCare report summarizing the results of your patient will be sent to you along with a validated antidepressant job aid. Now let's talk about the DepCare summary report. In this example, Mr. Jones is 72 years old with a history of diabetes, coronary heart disease, and chronic pain. He completed the DepCare tool on his phone with help from a DepCare coordinator and his daughter. His doctor and care manager received the summary report. On the left, you will see that Mr. Jones prefers to start a medication to address his mood and migraines, that his PHQ-9 score is 21, and that he is currently seeing a counselor. To the right, you will also see that Mr. Jones is not suicidal, that he prefers medication, and is concerned about cost, transportation, and stigma. Whether or not you prioritize discussing depression with your patient during the visit is up to you. However, if you choose to discuss depression, how you talk about mental health can make a big difference in whether a patient initiates treatment. Even patients who are already on treatment for depression may benefit from interventions from their primary care providers. The DepCare summary report helps you involve patients, optimize treatments, refer to collaborative care, and document their history. Involve patients in treatment plan, such as review barriers, counsel on adherence, and review options. Optimize treatment by combining meds with therapy or intensify medications. Refer to collaborative care for patients with a PHQ-9 score and GAD-7 score greater than or equal to 10. These patients are appropriate for short-term treatment with primary care providers who can titrate medications with support from the collaborative care team. Patients who have schizophrenia, psychosis, bipolar, substance abuse, or PHQ-9 or GAD-7 less than 10 are not eligible. Document history, concerns, and treatment plan. See the description on the right as an example. Use the DepCare smart phrase to add depression and anxiety screening and plan to your note. You should now have a better understanding of DepCare and how it works. We hope this tool can help you screen and treat your patients for depression, as well as improve patient-provider engagement. For more information, contact Dr. Natalie Moyes.